Native American youth die by suicide at some of the highest rates in the United States, more than 2.5 times the national average, according to the Centers for Disease Control and Prevention, CDC. This crisis has left many asking, why is this happening, and what can be done to prevent it? One major factor is historical trauma. Native communities have endured centuries of forced removals, boarding schools, cultural suppression, and systemic discrimination. These wounds have been passed down through generations, creating high rates of depression, substance abuse, and mental health struggles. As Lakota psychologist Maria Yellowhorse Braveheart explains, historical trauma doesn't just disappear. It manifests in cycles of grief and despair. Another issue is poverty and lack of opportunity. Many Native youth grow up in communities with high unemployment, poor schools, and little access to health care. Without stable opportunities for the future, feelings of hopelessness and isolation can become overwhelming. Studies show that economic hardship and lack of educational resources contribute to higher suicide rates among Indigenous youth. Mental health care is severely lacking in many Native communities. The Indian Health Service, which provides medical care to many tribes, is underfunded and understaffed. Many reservations have few, if any, mental health professionals, leaving young people without access to therapy, counseling, or crisis intervention programs. Even when services are available, stigma surrounding mental health can discourage Native youth from seeking help. Bullying and discrimination also play a role. Native students in both reservation and urban schools often experience racism, cultural isolation, and bullying, leading to feelings of alienation. The loss of cultural identity, caused by generations of forced assimilation, has made it harder for some Native youth to feel a sense of belonging and self-worth. Despite these challenges, many Native communities are fighting back. Tribal-led suicide prevention programs have begun integrating traditional healing practices, community support, and modern mental health resources. Programs that reconnect youth with Native language, culture, and ceremony have shown promise in reducing suicide rates. As Navajo activist Daryl Tonema puts it, our culture isn't the problem. Our culture is the solution. So, why is suicide so common among Native American youth? The answer lies in historical trauma, economic hardship, lack of mental health resources, and systemic neglect. The real question is, how can we ensure that Native youth get the support, hope, and opportunities they need to thrive? What do you think? Let's continue the conversation.